impact right now, right? So tell me a little bit about why AI in healthcare. Talk to me the reason. What is the potential? What's the promise here if we solve it?
Yeah, right. And I think the promise, as you said, is immense. I mean, we are talking about healthcare in privileged sector. We haven't even thought about, remote areas where the resource settings are very poor or
Mm.
it's not even there. Um, I mean, the potential to outreach using AI is a lot faster than having to train someone in the space in this dentistry or in healthcare, which takes years and years, right?
Huh.
Think of it in COVID. How did our dental students or healthcare students were impacted? They could not have their hands-on experience, right? So the thing is, if you actually compare a dentist, it takes anywhere between 5 to 10 years before they really can become an expert in reading these X-rays. Whereas if you built an AI model, right, it can scale so fast. We are not saying the AI models are perfect on day one, but they train, and once they get the training and they are fed on these data set, eventually they do perform, and they're able to find. And again, by the way, they're not replacing anybody, but they actually aid a dentist or a health provider in a more
Yeah.
comfortable way. In a way, we call it a second dentist or a second expert
Augmented.
sitting next to
It's
them.
the
Exactly.
Jarvis suit for the
It's a
dentist, right? So
Absolutely, absolutely. And by the way, the technology has enabled it. I would say even 7, 8 years back, market wasn't ready, people were not ready, but now they are. From both, I would say, consumer side, both from the provider side, as well as the technology like 5G coming into picture. We have more compute powers. Our, mobility is much better. All those things definitely have added a lot into really reaching out with what AI promises to bring. So I think this is a great time. There are so many use cases that we can see with AI. It's not just diagnostic on deep computer vision, NLP. There are like different facets that we can see if we combine together, actually bring a great use case.
no, look. It so happens that I also lead a healthcare AI tech company, right? So Autonomize, and we haven't really talked about what we do in public because just kind of in semi stealth in the process of coming out. But one of the things that the theories I have, and I want to test this with you as well, is that I think, look, health and data are two very noble things. So if you think about like data becoming or is already, there's enough evidence that the most valuable asset in the world is data, right? I mean, not just how organizations make money off it, but if we really look at how much market cap Facebook or Google has generated by using human data, right? I mean, just human generated data sets. It's a very good evidence on the one hand. And we now have the technologies, the methods, the process, and the research to go harmonize and get maximize the insights and knowledge residual in the data. On the other hand, improving the human condition post COVID, at least everybody got a really good wake up call. People who have never lived through plagues and world wars, and everybody, it was very evident that one of the most noblest pursuits is to go improve the human health condition, right? And then for us, for me personally, it's about bringing the two together. Like, how do you actually guys get the engineerable problem of gleaning insights from the data and apply it to improving the human condition? And but what you said actually, reminded me of two things. One is the how should AI help, and the opportunities now, which is very evident, a lot more data than it was and stuff. But there's a lot of challenges because most of the data in healthcare is human generated data, right? It's about the humans or other things, but including research, doctors' notes, x-rays, imaging data. It's human generated, aka not easily computable or analyzable at scale, right? That's on the one problem. The other thing is about this whole notion of I think there was all this concerns, and this I can relate back to my friends at IBM Watson. Like, they are to blame when they actually said Dr. Watson is going to be the next biggest oncologist. The reality of the matter is healthcare and is actually care primarily. So it has to have a human in the loop, at least for a foreseeable future, right? And nobody's going to complain about, because we have a shortage of healthcare professionals, not a surplus. So nobody's going to get replaced. If anything, they were going to get augmented on this thing.